Okay, so I'm trying to look at another aspect of trying to approach patients that have high blood pressures, and this is you trying to do a fundoscopy for them. So fundoscopy is like I'm actually trying to look at inside the eye. Okay, I'm trying to look inside the eye. Of course, I'm trying to pick up any abnormalities in the blood vessels. I'm trying to see if there's depositions of anything within the eye. So fundoscopy for patients that have high blood pressure. Fundoscopy is also known as what? Ophthalmoscopy. It's a vital diagnostic tool in evaluating patients with high blood pressure, especially when there's a concern for hypertensive retinopathy or hypertensive emergencies. So just mostly have to do the blood vessels there. Are they weak? Are they becoming stiff? Will they burst off? So clinical purpose, reason why you are doing a fundoscopy, you want to dictate hypertensive retinopathy. So this will reflect if there is damage to retinal blood vessels due to elevated blood pressure. You want to assess if there's risks for organ damage or there's organ damage already. You want to identify signs of chronic hypertension, acute vascular changes. Okay, so key findings in the retina: if it is grade 1, there's mild narrowing of arterioles. Grade 2, there's arteriovenous nicking. So this is basically the clinical implication. It will help to tell you which level of hypertension that this is at. Grade 3, hemorrhages, cotton wool spots, exudates. Then grade 4, that's when you're talking about papilledema. Okay, and it's hypertensive emergency. So when is it crucial? This is when the person is having high blood pressures. Okay, visual symptoms, so the person is not being able to see well, so you are looking at the eye to actually access the source. If you are suspecting that organs are now failing, then also in pregnancy related hypertension, which funny enough, this is where I read about fundoscopy for patients with hypertension. Okay, so in emergency settings, fundoscopy can help to identify patients that are at risk of developing strokes and other complications of high blood pressures. Okay, so that's what we have on fundoscopy examination.